Dr. Eric Broadworth here with my top 3 exercises for you to treat your sciatica. So the first one we're going to go over, I'm going to get down on a mat just like this, and I'm going to grab behind my leg where I have my sciatica. So if I've got the sciatica on this right leg here, I'm going to lay back. I'm going to take my hands, okay, and I'm going to grab behind my thigh like so. I'm going to point my toes up towards my head, okay, and then I'm going to kick my knee straight, and a lot of you might feel a pull behind the knee or into the calf here. Once I get to that point, all right, now I'm going to floss the nerve by pointing my ankle towards the ceiling and then pointing it back towards my head. I'm going to do that 10 times. And then on the 10th one, I'm going to try and kick my knee a little straighter, and I'm going to do the same thing. So you should notice a little more range of motion as you do this. It'll loosen up, okay? And I'm going to do about 3 sets of that. And that's to help mobilize and elongate that sciatic nerve. Now the next stretch that I'm going to do, my second exercise for you, which is a stretch for sciatica, is if it's that same right leg, I'm going to cross my leg over my knee like so. I'm going to then reach behind, so through the hole here, behind my opposite thigh, and then I'm going to pull that thigh, and I'm up towards my chest, and I'm going to feel a stretch right into my butt there, okay, right into the right buttock, and I'm going to hold that for about 30 seconds, and then I'm going to relax. And I'm going to do that, I have my patients do it 2 to 3 times. Now the third and final exercise, this one's important. It's to help build some strength into your glutes, okay, to help improve that pelvic stability. Again, if this is my right side I'm working on, I'm going to straighten my other leg. I'm going to have my thighs parallel, okay? You want to keep your thighs parallel. I'm going to lift my hips up going into a bridge. I'm going to pause. I want to make sure that my pelvis is level. You don't want your pelvis to drop. You want to keep your pelvis level and then back down. So you're going to go just like so. I'm going to do 10 times, and then I'm going to switch sides to the other side. Okay? And usually I have my patients do 2 to 3 sets of those exercises as well. Now, everyone's a little bit different. Those are some pretty generalized techniques. What I recommend is if you're having symptoms for longer than 2 weeks, to get in to see a healthcare professional. If you have any specific questions for me, please leave them in the comments below. I'd be happy to help you out. I hope those exercises help you out as they've helped a lot of my patients. Those again are my top 3 exercises for you to treat your sciatica.